Hey guys, the screen looks okay. There we go. I was like, I came back and looked at the screen, it looked different. Hey guys, the screen looks okay. There we go. I was like, I came back and looked at the screen, it looked different. Hey guys, the screen looks okay. There we go. I was like, I came back and looked at the screen, it looked different.
Oh.
Hello.
Hey, Frank.
All right, guys, we are at 7 o'clock. Everyone has been anticipating this meeting with this esteemed group of panelists. I want to introduce myself. My name is Frank Wiley. I just hopped off the desk right here at 5 o'clock on Channel 5. You can catch me here Monday through Friday, sharing the local news and the hour-long newscast, also sharing the stories that you know and love right here in the community. A big chunk of the headline has been filled with coronavirus stories, which is why we're having this conversation this evening. Again, News 5 at 5 o'clock. But I want to get to the group of folks on this broadcast with me, beginning with a brief overview of the bios. I want to introduce to you Dr. Charles Maudlin, whom I met through several stories over the course of time, covering several issues in the African-American community. Now, Dr. Charles Maudlin is a kidney transplant surgeon and urologist at the Cleveland Clinic. Now, Dr. Maudlin, by the way, is the first African-American staff urologist in the history of Cleveland Clinic and is one of only approximately 20 Black transplant surgeons in the nation. So he's doing great work out here in our community. He is also appointed to the Ohio Commission of Minority Health, and Dr. Maudlin shares the prestigious BPACF, Black Professional Association, Black Professional of the Year. Back in 2015 is when he received that honor. So that is Dr. Charles Maudlin. Also, I want to introduce to you Larice Purnell. Now, Mr. Purnell has 18 years of experience in business management that involves tax finance. He is the co-owner and managing partner of Cleveland consulting firm and accounting, tax and payroll company located downtown in Cleveland. He's got all the answers when it comes to your money, my money, his money, everybody's money. He is a strong, innovative financial and strategic leader and author of Financial Foundations, Building Financial Freedom, One Tool at a Time. And I want to remind you guys, because we're kind of blowing through this, because we want to get to the questions that all of you have. But by the way, you can check out the full bios on the bpacf.org link. So check out all the bios there. And of course, we would like to introduce to you Vanessa L. Whiting, Esquire, and President of AES Management, Popeyes, Louisiana Kitchen franchise. Y'all holler at her about those chicken sandwiches. Y'all know what I'm talking about. Vanessa is president of AES Management Corporation, which employs over 600 Cuyahoga and Summit County residents and happens to be one of the largest Black owners of Popeyes Louisiana Kitchen franchises in the country, with 16 Popeyes locations right here in Northeast Ohio. Vanessa L. Whiting is a member of Governor's Ohio COVID-19 Business Advisory Task Force. Also, Ms. Whiting also shares the prestigious BPACF Black Professional Association Black Professional of the Year recognition for 2019. She won it way back in 2019. I want to pose a question to all of you guys. How are we holding up, especially considering the circumstances? How are we doing?
Pretty good. All considered, pretty good. We are still standing.
Still standing. You doing all right, Dr. Modlin?
Yeah, we're doing all right. I'm especially proud of how the caregivers at Cleveland Clinic have responded, the doctors, the nurses, all of our 70,000 plus caregivers. So everybody's hanging in there, and we're looking to get patients back and taking care of them for everything.
Yes. Maurice, you good, man?
I'm good. Just trying to do the work and just be here for our community, my staff, as well as my partner, Meltree Sharp. We've been just in the community, really just trying to make impact and help those that are in need. So it's been good stuff. Just trying to keep our spirits lifted. Good
stuff, great stuff. And I assure you guys, this is water. I'm gonna be sipping on this from time to time. It's high quality H2O. Yes. We'll get started from a health standpoint, although all of our experts here have all the answers you need to hear regarding COVID-19 and the issues that are in the African American community. But we want to start with Dr. Modlin. Dr. Modlin, that old adage, when America catches a cold, Black America already had pneumonia. And it's sad because that old adage came up years ago, but it still seems very applicable to here and now.
Sure. That actually is a very profound statement. And first of all, I'd like to thank the BPA CF for actually hosting this event. I've been actually looking forward to this along with my other esteemed panelists. But I also wanted to first off, maybe I can show my first slide. I always start off my talks by recognizing my father. Charles Modlin Sr., he passed away in 2010, but he was my biggest inspiration, along with my mother, Grace Modlin, for basically instilling within me the importance of giving back to the community. So I always want to start off by recognizing my father, my mother. My father actually was a National Senior Games Association gold medalist. He still holds records for men over 80 and 4 track and field events. So I'm trying to fill his shoes. I don't think I ever will, but to get into the subject matter, we're here talking about this COVID pandemic, and there's a lot I could say about this. I've given a number of interviews and talks over the past several months, and really what has struck me is the fact that we have seen, I'll take the next slide also, we have seen the fact that African Americans, like you indicated, disproportionately are experiencing not only acquiring the COVID virus, not only suffering more severely from the virus, but also have a greater incidence of dying, succumbing, perishing from the COVID-19 virus. And I'm going to get into some of the reasons for that, but I have on the screen there some data. It's a couple weeks old from May 16th, but it's data showing that out of all of the deaths in the state of Ohio, 265 Black or African Americans have died from the COVID-19 virus, 23 Hispanic Latinos, and 11 Asian Americans. And you can see that is disproportionate to the population in which we're represented in the state of Ohio and the nation. Mm-hmm. So African Americans are represented by about 13% of the population in the state of Ohio. We actually represent about 25.5% of the cases of those individuals who have acquired the virus, 30.4% of those who have been hospitalized, and 16.5% of those who have died. And you can see on the slide there that we are overrepresented as far as our representation in the state, whereas white Americans are underrepresented. So the question that comes to mind is, why are African Americans more susceptible and suffering from the virus? I wanted to first start off by acknowledging the fact that I've been recently appointed to Governor DeWine's Minority COVID Task Force. And one of our missions and objectives is to educate the Black community, other minority communities as well, regarding important facts about the COVID virus, ways in which how we can mitigate the virus, protect ourselves, reduce our susceptibility. And by now, we've all heard a lot of information on TV, radio, news conferences about social distancing. I call it anti-social distancing. Wearing a mask, washing our hands, staying at home if we can. But we know there are what we call social determinants of health. And that, some examples as it relates to COVID and other healthcare disparities, is the fact that many African Americans, and research has shown this out, and we all know this, we are less likely to have jobs that allow us to work from home. Some other social determinants of health relate to transportation. We're more than likely, compared to other populations, to require us using public transportation. So again, it's been a little bit more difficult for us to social distance. Also, the reason why we're more susceptible to acquiring and dying from the COVID virus, and again, we're studying this on the strike force, it relates to the fact that we have a greater incidence of pre-existing or predisposing chronic medical conditions, and we have a greater incidence of health disparities. I've spoken about this for quite some time, and in fact, that's the reason why we started our Minority Men's Health Fair at Cleveland Clinic back in 2003, our Minority Men's Health Center in 2004. Unfortunately, because of social distancing requirements, we were not able to have our health fair this year. We're looking to resurrect that health fair next April, probably April the 15th. So hopefully we'll be able to do that. But these chronic diseases, some examples are higher rates of diabetes. In some instances, 80% greater incidence of diabetes, 44% greater death rate from heart disease, 30% greater death from cancers, higher rates of hypertension, kidney disease, stroke. I mean, so the list goes on and on across the spectrum of medicine. We have a greater incidence of chronic disease, which is borne out by the fact that we have about a 6 to 8 year shorter life expectancy compared to Caucasian Americans. And that even includes more affluent African Americans. So it's not just relegated to the lower socioeconomic groups. And a lot of the causes for these healthcare disparities relates to the social determinants of health. Like I mentioned, poverty, living conditions, poor housing conditions. And in many situations, we live in areas or neighborhoods that it's not safe to go out and walk. Education differences in many respects. But also there are some genetic, hereditary, biologic differences. For example, Black men have a prostate cancer gene. There's other cancers that are believed to have a hereditary component. And then when you combine that with environmental situations, then we're more prone to exhibiting or expressing a lot of these healthcare disparities. And so because we have these health disparities, higher rates of chronic diseases, we have a lower immune system that makes us more susceptible to not only viral infections, but fungal infections, bacterial infections, all type of infections, including the yearly influenza virus. Mm-hmm. And so once we get this infection, then it's believed, and we have to do more research, more basic science research, and we're doing that at Cleveland Clinic and other places across the country. But once we get that infection, the coronavirus, other infections, our bodies then have a hyperimmune reaction that causes more tissue destruction in our lungs and other parts of our body. And so that's the pathogenesis, what we believe is contributing to the higher rates of us acquiring the virus and then dying from the virus. So there are things that we can do to help protect ourselves, our families, our communities. And a lot of that has to do with educating ourselves, again, around ways to mitigate the COVID virus. But again, this goes well beyond what we're talking about, just the COVID virus. This goes to the point that we have to eliminate health disparities. We need to get in front of policymakers to promote, and that includes healthcare, hospital CEOs and presidents and administrators and insurance companies, so that we can develop ways to promote access to health screenings for the early detection of disease, so we can reduce these disparities, reduce these comorbidities that are contributing to these infections. So I can say more, but I'm going to stop now. I'll let the other panelists speak, because Larissa and I, we spoke earlier that we know everybody's just tuning in to see Vanessa, and Frank. So I'll let the other panelists speak. So
all great information, Dr. Modlin, and we're going to circle back to some of those points you made. It's clear that poor health is not the only heirloom we hand down, and for that we could segue to Larice, because talking about it from a financial standpoint, everybody took a hit, but we've had several conversations about the financial hit that strikes even harder in our community. Can you speak to that?
Yes, and just like the saying that you said, when America catches a cold, we already had pneumonia. We didn't catch pneumonia; we had pneumonia. And when you think about that, when you look back at the Great Recession, when the average unemployment rate was 9.6%, we were at a rate of almost 17%. When we look at just in 2020, February 2020, when the last unemployment rate came out, it was at 3.5 overall, but we were at 6% as African Americans. And as I've talked to different state representatives, local representatives, business leaders, I've talked about the impact. If we lose 100 businesses in our community, that may be 20%. If other communities lose 100 business, that may be 1%. So the impact is not directly correlated. So again, as I've read through Essence, Forbes, truly we see that right now that there are over 50% of our population are African American women. And as they have been interviewed about the impact on their businesses, over 70% of them have said that they received or are experiencing a negative impact on their businesses. Home ownership is at an all-time low and continues to decrease within our communities. When we talk about the wealth gap, that we are more than 10 times lower. The average African-American family has a net worth, or I would say a wealth number of about 17,000, and where our white counterparts at close to 171,000. So these are gaps that, COVID is really exposing a lot of the issues. And my saying has been, recession equals reset. So we have to take great information that's being shared even today on this call with these great panelists, and utilize it to make sure that at a time like this, we can take advantage of opportunities, because the 1% tile of our country during a recession, they gained 80% of the wealth that was created during that time. They were able to be exposed to that. So we just got to use these tools and this information that's being talked about. So we are directly being impacted. And, Frank, I can get in. We talked about the PPP, access to our community. That's a real deep conversation.
Sure.
And I'll dive more into that later.
Yeah, we can. That splinters in so many different directions. And I want to ask Vanessa, who Dr. Modlin told us the truth. Everybody wants to hear from Vanessa. Got it right here. Vanessa, you are seeing it up close and personal because of the multiple Popeyes restaurants you own. You are employing people, but you're also working with individuals who may not have a clear understanding of the severity of this situation, and you're approaching it from a business standpoint. How does one juggle that?
Well, we as employers, I'm going to talk to the employers and employees and our customers. We have a responsibility. I have a responsibility to my employees and to our customers and to the greater community. And the first responsibility is to do all that we can to keep our employees safe. Dr. Modlin talked a little bit about the disparate impact of COVID on our community, and it has particularly struck our seniors. So it's critical, and I employ a number of people, and many of them are young people. And if they get COVID, it may present as a cold, it may present as a flu, it can be much more serious. But generally speaking, and Dr. Motlin can support me on this, the younger, the millennials, the younger people will, they'll be okay eventually. Now, some have very serious complications, so I'm not trying to diminish that at all. But my point is, we have to be particularly attuned to our seniors and to those who are more vulnerable.
Yeah.
I say that because much of what we do is try to coach and train our young people that you're wearing protective gear, you're wearing a mask to protect your fellow employees, to protect yourself, because it's mutual, and to protect our customers. And as important, to protect your mother, your grandmother, your aunt, your auntie when you go home. So my message to my younger employees is that we are all in this together, and it's a mutual, not just respect, but it's a mutual caring for one another. But I'd like to talk a little bit about to the business owners in the room. I don't know if you want me to do that now or wait till later.
No, feel free, because you have important messages to share with them. Go ahead and expound on that thought if you don't mind, because we're going to jump right into this conversation.
My fellow business owners, first of all, I know how devastating it is. Some of my dearest friends had to close their businesses. We were an essential business, so we did have the opportunity to stay open, and we had to navigate. We bought facial coverings before we could access masks. And we'll talk a little bit about PPE and where you may be able to get some. But there are a couple of websites I'd like my colleagues to take down. One is covid.ohio.org. I'm also on the governor's business advisory committee. And our first phase, we're the ones who came up with the mandatory and the recommended opening requirements. So if you have opened your business or you're opening your business, you need to go to covid.ohio.org, and you can pull down the specific reopening requirements for your sector. And I did have some slides, but I understand the print was too small. The print was too small, but if you go to that website, you can find your reopening requirements for manufacturers, for hairdressers, salons, retail, consumer, and restaurants, and every other sector. So I'd encourage you to do that.
Yes.
Also, you will find posters and a lot of resources that you can use in your place of business so that you don't have to go out and print this information. Restaurateurs, I am on the restaurant advisory committee as well. Go on that same website, you can pull down the mandatory and the best practices requirements for your business. There's some general business practices that we all must follow. Mm-hmm. Dr. Motlin already mentioned some of those. It's social distancing where you can. Now, in a place of business, if you're unable to social distance, and quite frankly, the back of the house of a restaurant, those of you who own restaurants, you know that commercial kitchen, it can be difficult to social distance. So what you have to do is, if you can, you have to wear masks. Your employees have to wear masks. I want to say, for those who are working in a kitchen that's 110 degrees, the masks were not made to be worn in a commercial kitchen. So there may be from time to time where the public sees someone with the mask pulled down.
That could pose another health issue.
That could pose another health issue if you're not taking breaks and a breather, and your body temperature is rising. So, but nevertheless, fellow employers, that is a message. So you have to, give frequent breaks, keep your employees hydrated, make sure your HVAC system is working, and have a place where they can go so they're away from people when they have to take that mask down. So we talked about, so there's PPE. It is difficult, and the governor has said that they don't want us buying K95 masks because we're reserving those for the hospital workers and first responders until they can stand up the supply chain.
Sure.
Again, if you go on that website, you can find consortiums, and the state has put money aside for small businesses to be able to access the mask and some of the other PPE. So that's one website. There's a small business page also on the website. So first, go on and get your reopening guidelines. Then you want to look at, there's a list of federal, state, and local financial resources, because I know liquidity is a problem for many of us, many businesses. Cash flow is a problem. You've been closed down. Hopefully you preserved all the capital that you could. You may have had to lay off your employees. So there are, in addition to the PPP, let me tell you, PPP still has $120 billion. So the first round was oversubscribed, but there is still money in that second round. So if you have not applied, you still have time to apply. There are strategies, and Larice made, I know he spent a great deal of time counseling people on that. So he has some tips for you. But on the same website, you can find, so now let's talk to the consumers and employees. Employees, there are financial family resources for your family, also resources for individual. And you can go on that same website and find out some of those resources.
Sure.
Now I'm going back to my, am I flowing into, I don't want to, I could go on forever. So I'm going to stop here. But there's some other things, some other responsibilities that employers have with the new federal government Families First Act. And I'll talk about that maybe.
Dr. Modlin, in terms of social distancing, we constantly hear 6 feet. As Vanessa was talking about social distancing in the restaurants, is 6 feet really enough? I mean, there are so many unknowns at this stage of this dealing with COVID-19. Is that really enough? How many feet should we have between ourselves and the next individual? And can you talk about the importance of this right here? I mean, sure. I don't leave home without it anymore. I got to have it like my keys, because I want to make sure I'm doing everything on my part, along with, my hand sanitizer. I got to have that everywhere I go. Can you kind of talk about how much distance we need to put between ourselves? And also, Dr. Modlin, the fact that, among many medical professionals that I've spoken with of late, there's a lot they know, but there's also a lot at this point in time, they do not know the answers to some of these questions.
Yeah, this is a new virus, and so you're right. There's a lot that we don't know, and actually we're learning a lot every day. Actually, I saw a report yesterday that actually addressed the question about is 6 feet enough, and what the researchers, and we need to do more research, obviously, but the researchers that conducted this study actually demonstrated that the virus actually can live in the droplets can actually stay around in the air quite a bit of time. But actually they said that if you're outside in a humid environment, 6 feet may actually be enough, but actually if you're inside, especially in an environment with air conditioning and recirculated air, that 6 feet may not actually be adequate enough distance. So again, we're learning a lot as we go along. There are some similarities to the influenza, and there are some things that are different. As far as mitigation and wearing masks, the recommendation is to wear mask in public, and in situations where you cannot social distance. The masks are actually designed to protect others from us. So if I wear a mask, the mask is actually designed to, if I cough or sneeze, to prevent those droplets from being somebody else being exposed to me, and vice versa. There is something I wanted to bring up. It relates to social determinants of health. It relates to, unfortunately, a news story that's in the news up in Minnesota now. Racial profiling, racism. That's a social determinant of health as well. Mm-hmm. There are a lot of black men. I've had my own patients actually express this to me. I've seen the reports of this. There are a lot of black men in particular, I'm sure women as well, that are reluctant, hesitant, reticent to wear a face mask in public due to fears of being racially profiled. And so, again, that goes way back in terms of the history Tuskegee syphilis experiment, historical distrust that we have developed, rightfully so in many situations, towards healthcare providers and quote unquote, the system, the government. So we have to keep in mind that a lot of the messages that are going out there to help educate the public about social distancing mitigation, we actually need to tailor a lot of those messages so that they'll be more effective in reaching the Black community. To that matter, we actually, Cleveland Clinic, about 15 Black doctors got together and we produced a public service announcement. You're going to see it on TV, hopefully. Hopefully we'll be able to run it on your radio, your TV station. Frank.
We need it.
But it's designed to better impart this important life-saving messaging to the minority community as opposed to one-size-fits-all messaging.
I'd like to add to that, in addition to the social distancing, and I didn't finish the thought, for business owners, you are able, in some cases where you can't social distance, you can erect barriers, and you'll see that in the mandatory statement. For example, in our restaurants, we haven't opened our lobby yet, but you will see shields similar to what you see in a grocery store for carryout. There are shields now in front of the cashiers. We also added shields at the drive-through window where we could. So they're plastic shields. In some cases, an actual physical barrier, and in some of my restaurants, we already had a barrier, can act as mitigation and is acceptable to the health department and is acceptable under all of the best practices that we were able to discern. And many of the businesses that were on the committee were open globally. We had people in China, we had businesses in China, so they had experience of what kind of mitigation was most effective. So that's one thing to keep in mind, that you can reopen if you have barriers, if you erect barriers, if you cannot do the 6 feet.
I want to remind people quickly as well, we are taking your questions, so feel free to hit us up. Let us know what some of your questions are, because we're going to get to those and we're going to ask you, and we're going to ask these questions of our panel right here, what their thoughts are regarding your concerns. So we want to make sure we get those out there. Don't be shy. Throw any question you may have out there and we'll get you some answers. Larice, I wanted to ask you this because I heard the word millennial thrown out there just a moment ago. And that particular group of individuals dealt with the Great Recession, getting fresh out of college for many people and fresh into a lot of debt. And now many folks in that age group just now getting on their feet. And now COVID-19 has sickened many people and sickened our pockets. What advice would you offer to that specific age group of individuals?
Yeah, that's a great question, Frank, and we've had the opportunity to kind of dive into that in prior conversations. But if you look at the national average right now, millennials coming out of school are making $55,000. They're leaving college with more than $30,000 in debt, and on average, only 1 out of 10 of them have $1,000 saved, and over 78% are living paycheck to paycheck. So when you have a pandemic hit, they weren't prepared for that. So what it really realized that they had to do is go back to the basics. And so, if they're listening, I would say if you have a child that's a millennial or you are a millennial, I want to say you have to go back to the basics. And a couple of things that I wanted to share from that perspective are you got to reprioritize your expenses. A budget. We always talk about a budget.
Wait, what's that?
And most people don't even have a budget and they own a business. So personally, we talk about that. There are great resources like Mint, MINT. That is a great resource that you can put as an app on your phone that can help you really balance your expenses to really see where you're overspending to ensure that you have margins. And people say, well, Larissa, if I have more money than I have bills, then that means that you have to readjust some things. Maybe you can't have Netflix or DirecTV at this time. Maybe it's time that you have to make some hard decisions and downsize or move back home if mom and dad will allow you to do that. But even things as I'm teaching, as well as I go around teaching the financial literacy courses, that you truly have to, minimize, again, your expenses, but keep cash. Right now, people are saying, so Larissa, are you saying use debt? No, I'm saying cash is king in times like this. And Vanessa, as an entrepreneur, you know that because we don't know if this is only the first round of PPP. Is there going to be another round? So how is that going to impact their jobs, their ability to be able to go back to work and to be able to expound on their careers? So again, those are some things I'm saying. Consolidate those student loans, because rates are right now at an all-time low historically right at this time. So if you have a mortgage, so we have, young adults that own a home, look to refinance, that home, look to consolidate that debt, look to call credit cards and ask them, will they go down on your bills? And one thing I think we all can say we're guilty of, because we don't have a lot of time on our hand, we never just sit down and look through every expense we have and say, when's the last time I reduced my life insurance cost? I didn't say get rid of life insurance. I said reduce that cost. When's the last time you reduce your auto insurance? When's the last time you look to refinance debt? And Vanessa, and I'll point this question at you, or this statement. We all know another thing I want to say is partnership and relationships are vital in times like this. Right? I don't care if you're 25, if you're 35 or 45 or 55, your banker, your attorney, your accountant, your financial advisor, your insurance broker. Those are people right now in times like this where a lot of our community could not take advantage of the resources, is because they didn't have access to people and resources. So that's what I would like to share as well.
And we're hooking all that up right here. Vanessa, you as a business owner, you always have to look into the future. You have to have a bit of a forecast, right? A financial forecast. What advice would you offer to fellow business owners in regards to looking into the future when you really don't know what this outlook is going to look like?
Right. And Larice touched on it. This took everyone by surprise. I mean, one day, we were in a thriving economy, and then the next day, I remember the day. It was March 18th. I opened a store in a pandemic. Okay. I was on my way to Brush High School to hire 30 young people for, I've got a new store. Here's a little plug. We opened a new store on Warrensville in South Euclid. Very excited to open that store. And I was headed over to talk to the young people at 3:00, and a wonderful teacher there had been working with her students and working with my staff and working with me. And it was 3:00, and she called and she said, Vanessa, you can't come in the building. I said, well, I'm here. I'm getting out the car. She said, no, the governor just closed the schools. The next week, we regrouped. You have to know how to pivot. We regrouped, and I said, well, we're going to move ahead. We're not sure what this is going to look like. And the day we opened was the day the governor shut down the state. Brand new store, sunk costs, right, business owners? Sunk costs. You sign, order the food. The food is in the freezer. The people are hired. What do? You have a choice. My choice was to move forward. I thought I was crazy, but I moved forward. I already had sunk costs, but I also believed, just from the trap, that people were going to have to eat, and we were essential business, and particularly in many of our neighborhoods. Say what you want. Oftentimes, we're the only business open.
Oh,
and affordable.
Yes.
So I feel very strongly that there were too many people depending upon a paycheck, and if I closed my doors, I could not afford to pay 600 people with closed doors. So
you didn't want to do them a disservice.
I would do them a disservice, and they are wonderful. They show up. They continue to show up under very difficult circumstances. And yes, many of them are young people, and this is their first job, and they are making minimum wage, but many of them aren't making minimum wage. So here's my plug to the millennials.
And you're hiring.
We're hiring. We're hiring managers. And you mentioned 55. Well, we start anywhere between $40,000 and $50,000, but there's also the potential for an $8,000 to $10,000 bonus. And I am adding a career path for those who are seriously interested in going into business for themselves. They can train with me. And if you're stellar and you prove yourself, there's a profit sharing opportunity.
Oh, there we go.
And then you can,
We got the graphic right there.
Someday own your own Popeyes or McDonald's or find out whatever it is. We will teach you how to run a restaurant. We will teach you food costs. We will teach you labor. You will hire and fire. And so I have young people who graduated from Ohio State. One young lady worked for us when she was 16 years old. She's still with us. She has a master's, and she will move on. She will move on, but she may move on and someday come back and own her own franchise or start her own business. So those are the opportunities that we have always promoted at AES, and we will continue to promote. So, I promised my people I would do everything I could to stay open. We haven't laid anyone off yet. And you said, Larice, we don't know how there could be another wave, but we are, we did apply for funding. That helped. We didn't, but that was down the road. In the moment, I didn't know what was going to happen, but
that's right. That was a process.
Yeah, you got.
I know you're not supposed to be religion, but Christ is the rock I stand. All other ground is sinking sand. So we moved forward, and I told them, if you stand with me, I will do everything I can to keep these doors open and keep you employed, and that has worked out. So how do you do that? How do you do that? And I've talked to my colleagues who had to shut down, because that's just tough. And I have dear friends who won't reopen, but not in the way they were, but they're going to reimagine their business. So I would say to those of you all who had to shut down, you can still reimagine your business. You still have the skills, right? If you had the skills before, you still have those skills. So there are other ways, and there are going to be other opportunities out of this. There'll be other opportunities out of this. Yes. But Larice talked about it. It's preserving your capital. It's finding that 2%. What do I mean by that 2%? How can you reduce your costs? Where can you look to reduce your costs? Whatever your cost of goods are, you renegotiate with your suppliers. If you have a lease, you renegotiate with your landlord, right? Because he'd rather get something than nothing. And maybe if you have to defer that lease payment now, but if you've been a good tenant previously, you talk to your landlord. You negotiate utility rates. You can do that. You can shop utility rates.
Sure.
You need to look at every expense that you have. I guess I would be a shameless plug, but I have a very good accounting firm that is working with me now, and they will tell you I'm up till 4 looking for that 2%, and how you can. And in your case, if we went down right when it happened, sales dropped at some stores 65%.
That's right.
Right.
65 to 95%. Yeah. And yet I kept moving, but it's rebounding. Okay. But we had enough, and I've been blessed. I had enough cushion. I had enough reserve. So that's what Meltrice.
That happens all the time. Meltrice Larice.
I do that all the time. But you have to be conservative and reserve in the good times. Okay. Of course, nobody saw COVID, but I had enough reserve that I knew I could get beyond, 60 days. And the average small business has enough cash for 30 to 60 days. So I'm talking about in the future. What can we do in the future? I know liquidity is crazy, but there are resources if you think you can reopen. But capital preservation, reducing your expenses, and don't take on a lot of debt if you can't pay it back right now. That will just strangle you.
That is a simple solution.
Right. Well, it looks good, right? We're like, well, I can get this low interest loan, but if you have to do the numbers. You have to sit down and run the numbers.
If you ain't got it, don't get it.
If you ain't got it, you can't pay it back. Don't get it.
Yeah. But to say that though, with PP, so I want to make sure I jump in on that point, because Vanessa, you are aware of that. Everybody's getting these emails from the SBA that they've gotten approved for, $75,000, $150,000 for the disaster recovery loan. The key thing is it's still a loan. So you got to make sure that you have the proper cash flow to cover that debt and to cover that, any debt that you take on this time. Because some people are getting grants and then some people are getting loans. And in some cases, they were drowning before, COVID-19 hit. So that, acquiring that debt and having no control or no plan around it could drown the business even deeper, and especially if they're signing on as a personal guarantor. So
great advice. And I don't want to forget Dr. Modlin over there, because all of these things that we're considering, all these bullet points, enough to stress anyone out. Speaking of which, Dr. Modlin, I'd be remiss if I did not ask you what we need to do in regard to mental health.
Sure.
There are so many people who don't know what to do. They just keep compartmentalizing their feelings, their financial stresses, and they keep moving physically, but mentally they're stuck on some of these issues that have impacted them, some of which has raised a lot of questions with their family, how they're going to survive. What should one do to ensure mental stability in the midst of all this madness?
Sure. That's actually a great point. And unfortunately, a lot of healthcare providers that a lot of times we overlook the importance of mental health. Depression, stress, anxiety actually can translate into physical manifestation of disease, hypertension, heart disease, stroke, other conditions. I wanted to first start out and let you know, most people don't realize I started my career cooking chicken at Kentucky Fried Chicken restaurant and famous recipe in Indiana. So I started out as a chicken cook. So
I'm gonna give you a chicken sandwich one way or the other. I'm getting a chicken.
Yeah, I don't know if everybody can see. Can you see this book?
Yes.
It's I actually haven't read the whole book yet, but I've started reading it because I'm trying to even further educate myself. My sister actually is and I get her title wrong all the time, a psychotherapist down in Houston Psychotherapy Associates. She actually has a whole curriculum online that talks about stress and self-coping techniques. She actually has a toolkit that people can access. But this is the Unapologetic Guide to Black Mental Health. And it just points out the fact that we need to focus more attention on the mental health components, because that's really the basis of everything. I mean, it's a form of alternative medicine, Reiki therapy, massage therapy, meditation, just going out and exercising. These things can actually be quite therapeutic and beneficial.
Chicken sandwich therapy.
Yeah, well, right. right. But no, that's a very important. But we have to partner with our ancillary and colleagues, and not just focus on prescribing medications to a lot of these conditions, whether it be stress, anxiety, depression. There are other ways to approach it. And also we have to maintain our spiritual health and wellness also. That's why I think it's so important. I'm so grateful to the Black Professional Association for actually hosting this event, because this organization is actually home to entrepreneurs, business people, medical professionals, financial specialists, teachers, educators, but also spiritual leaders. This organization comprises the whole gamut of the community who actually needs to come together to actually reach back and help the rest of the Black community and other communities.
Vanessa, I'm sure it's a safe assumption to say that you go out of your way to mentor some of these future entrepreneurs. You may see some of your ambition in them. What are some of the biggest lessons you find yourself teaching everyone you're mentoring? Because there are lessons that we may not get along the way. And when they get the opportunity to work with someone like yourself who has several business ventures, what do you find yourself sharing with them on a regular basis, especially in these tough times dealing with COVID-19?
Certainly. I do have maybe 5 right now, small business, 5 entrepreneurs that I work with very closely, and I've actually invested in their companies. And so I'm going to give a shout out to them. One is James Barnes. He owns a commercial cleaning company, Immaculate Cleaning. James is very focused. We talk maybe every once a month, maybe during this time a little more frequently. But I just share with him. We share together. We talk about the challenges. We talk about cash flow. When I get information, I was shooting it out to all of those. And I mentor a lot of young people, but these are specifically entrepreneurs who have a business that I've taken an interest in financially and emotionally. And so, you share other mentors, you share information. I'm sorry, I keep blending your date, but he talked about having relationships. So some of them had relationships with banks and some of them didn't, but I could help lead them and guide them to different banks. And with the PPP, some of the smaller institutions were more receptive and more responsive. So you don't always have to, I had a very good relationship with my bank. It is a major institution, but there were other credit unions that really stepped in. And so it's perseverance. Don't give up when you get a no. You all are seeing me 30 years hence. I was a millennial once, and when my late husband and I started this business, he was 27. I was 29. People weren't throwing money at us. Trust and believe. But so perseverance is very important. And you're not going to start at the top. You have to pay your dues. You have to be willing to work very, very hard. And that's what I like about the young people I'm working with in these businesses. Nothing is beneath him. He will do whatever he needs to do within reason and legally to help his business grow. He cares about the community. And when you give, you get. Is a smart young man. We look at data. All of these companies that I'm working with, we run on metrics. You have specific metrics that you need to meet, and that's what we're looking at. It's you have to know what your cash flow is. You have to know liquidity. You have to know your cost of goods. You have to know all of it. And if you don't know it, you need an accountant or an advisor to help you with it. And sometimes that advisor may be another business owner.
It takes a village to raise a business, huh?
It takes a village to raise a business. It takes good friends who will sit there and listen to you, talk about whatever it is you need to talk about. So those are just some of the things. But I did want to say, again, I'm going to give a shout out to Cleveland Clinic. I am the chair of the board of Metro Health, so I have to also give a shout out to
There's
Metro.
more resources out there, right?
What's that?
There were you alluded to some resources the other day.
That's what I was going to talk about. So I didn't want to. So we've talked about. It sounds kind of bleak, but I want to give some uplift because there are some resources out there to the daycare owners, and I'm looking at the questions about. Yes, minority business is a challenge. We were challenged before COVID, so I mean I get it, but let's talk about daycare. The governor just set aside $60 million to reopen daycare. Use those websites. And a lot of times we get the information after the money is gone. So I'm going to give a shout out. I just shouted out one website. Another website is the Cleveland Clinic's website. And I think it's up on the screen somewhere. The Cleveland Clinic to business owners will do a free assessment of your business and tell you what you need to do to open safely. And that's free. So that's very important. But my work on the business advisory committee, the first job was to come up with mandates and requirements. The second phase is to examine how can we stand up Ohio's economy and how can we make it more inclusive for Black businesses and Black people who want to start businesses. So you have institutions like Jobs Ohio. And this is the first time in my lifetime that I have heard people really authentically talking about what do we need to do to make it a more inclusive business structure. So go on those websites, look at that, look at those resources. But also, for example, as a community, we need to come together and assist upon broadband in our community. We have to have broadband. We're having remote learning. Doc will tell you, I don't know about you, Doc, now Metro, we're doing 73% more in telemedicine than we did ever before. You can have a device, but if you don't have broadband, what good is the device? So as a community, a collective, we have to come together, nonprofits, business owners, government officials, and they are So broadband. So that's one thing that we are looking at in phase 2. And also, what are the new big ideas? What are the new big ideas? Toby Cosgrove had an idea of standing up a medical corps, Doc, a medical corps. You don't need a college degree. The Army has trained medics, and it would be a 6 to 12-week course where you would be trained as a medic. You're not going into the Army, you're going into the reserves. So you still keep your day job, but you would be paid, and learn that skill. And there are other big ideas. There are ideas about, well, I'll have to come back and share some of them with you because they're not totally cooked. But what I'm saying now, this is a time for us as a community to talk about big ideas. Right. And I'm meeting with the chair of UH and the chair of the Cleveland Clinic to talk about big ideas and how we can collaborate, not just on COVID, but also the disparate impact that Doc has talked about. And also, when you think about medical centers and medicine in Ohio and in Cuyahoga County, those are job generators, right? So those are job generators. So we need all of the bright ideas now. Before, we're usually kind of running behind, but right now people are looking and listening for what are those big ideas to stand up our economy. One is bringing venture capital, private equity, mezzanine debt into a specific area to create, help me here, is the Atlanta, you're familiar with the Atlanta hub, the innovation hub, looking at something like that, bringing something like that to Cleveland. So in that area, you would have startup companies and mid-level companies and mature companies. Another thing is African-American businesses, and I'll be bold to say it, we have to learn how to scale up, right? It's easier if you've made some scale, you can weather the storm better. So that means sometimes collaborating and consolidating.
Yes,
and that's
touched on, yeah.
Collaborate. I said it, collaborating and consolidating. So instead of having 10 eagles with 2 employees, maybe we come together, pool our resources, and stand up a business.
Yeah.
I said it and I meant it. And so I'm working with young people who are willing to do that. And they don't have to be young. I mean, this is a time where you can reinvent yourself. As bad as it is, there are opportunities. I just told you about one. We're looking for people, and there are other people who are hiring people.
Take a risk, right? Take a risk.
Take a risk. If you already lost it, hey, come on. Let's start about even buying a PPP. Why can't we start a consortium? I hear people say, well, the government. What if 10 of us got together and invested in a manufacturing company that's making masks? That's not crazy. We can do these things.
The ideas are endless. And I want to tell people we have 2 more minutes of this portion of our session. Following this, an additional half hour of getting to your questions out there. One question that I must ask Dr. Modlin, what do we know in terms of a time frame of a resurgence of this? I say resurgence because we're seeing a bit of a dip in cases, although it may be a small decline, not where we would like to see it, a completely flattened curve, I should say. But at what point could we expect to see more cases? Is this for the end of the year, or is this at the same time that we might see the seasonal flu?
Sure. Yeah, so the thing is, again, this is a new virus. We don't really know what the natural pathogenesis and what the curve is for this particular virus. Some researchers believe that with the warmer weather and high humidity, that's going to make the virus more difficult to spread. And so we actually may see a downtick. I've actually seen some reports from some states. They've experienced actually a slight uptick since a portion of the economy has reopened. I mean, we've seen reports on TV where individuals are not social distancing, they're not wearing a mask. They've actually maybe become lax and not really maintain that mitigation. So we don't really know what the natural consequences or natural tendency of this virus is. I will say one thing. More research is needed, but more research with African Americans and other minority participants is especially needed also. I'll give you some examples. So, we are more genetically similar than we are different. However, those subtle genetic differences actually can herald the higher incidence of certain diseases. I'll give one example. So there's a medication called Bidil used to treat congestive heart failure. In the studies, they had enough African Americans in the study that demonstrated that when we African Americans take that medication Bidil to treat congestive heart failure, we have a 43% reduction in death rate, whereas white individuals had virtually no change in the incidence of hospitalization or death rate. So that just underscores what we call race-based medicine. There are some genetic differences where our bodies metabolize medications, but we're not really going to realize or understand that if we don't get more African Americans to enroll in research studies that are properly designed. Vanessa mentioned about biotechnology corridors coming to town. Actually, we're getting ready to break ground on Cedar Avenue. We're going to build a biorepository building. And so what a biorepository is, it's a collection of freezers where we have stored in minus 80 degrees blood and other specimens that our scientists, basic science researchers, can actually use those specimens and partner with one another, researchers, Cleveland Clinic in all parts of the country, to study healthcare disparities. One promise that we have from our Learner Research Institute here at Cleveland Clinic, because that biorepository is going to be built in Fairfax, a Black community, the researchers actually have promised to dedicate a portion of their research into research into the causes of these healthcare disparities, higher rates of cancer, diabetes, heart disease, kidney disease, et cetera. Vanessa mentioned jobs. The state of Ohio, the governor's Department of Health, and actually the local Department of Health here in Cleveland, they're hiring 1,300 contact tracers. So if you go to that Ohio COVID or Ohio governor's website, you can actually apply for a job, but you can go to the Minority Strike Force and see, get a job application. 1,300 individuals are going to be hired. One last thing about research. Some research actually has pointed to the fact that individuals who are deficient in their vitamin D levels, and African Americans, dark-skinned people, we are generally deficient in vitamin D. If we can actually replenish those vitamin D levels, it's actually been associated with improving our immune system. So that might be a protective mechanism. Again, more research is needed. So I'll stop there. But there's a lot more that I could talk about. But more research is needed. We need more African Americans to participate in that research.
Absolutely.
I was just going to, I see someone asked a question about, and I've gotten this question a couple of times about testing sites. And I just pulled this information up today. Cuyahoga County's public health department right now is really controlling much of the testing in Cuyahoga County. So next week, and this is from Metro, and Cleveland Clinic and UH are doing wonderful things as well. But we'll be doing 500 swabs a day. There are 30,000 high-risk individuals right now. So they're starting with the high-risk individuals. Those would be people in congregate living situations, homeless, group homes, nursing homes, women prisons, and vulnerable populations where it's hard to find testing. So, for example, Metro tested 150 people at the Word Church. That was the county. So the county has prioritized groups, and the hospitals, in at least Metro, and I know UH and Cleveland Clinic, are working with the county to get to the most vulnerable populations first. So it's not that we don't, and I have my Metro hat on, it's not that we don't want to come to churches, but they have a list, and they're targeting the vulnerable populations first. So we appreciate everyone who's reaching out to be a test site. But we're not controlling it. The county is, and they're implementing that program. So I just wanted to answer that question.
I'll say one thing that, African Americans, other minorities, a lot of times, because we have not established care with a primary care provider, we don't know that we are vulnerable. A lot of these conditions of which I've spoke of, diabetes, hypertension, heart disease, you can't, even cancer, you don't have to have any signs or symptoms. You don't have to have any signs or symptoms. So it just underscores the fact that you need a primary care provider. Actually, Vanessa mentioned now, because we're doing more virtual visits, telehealth, now it's easier than ever before to establish care with a primary care physician. We have a phone number at Cleveland Clinic, I'm sure Metro does, UH, where you can call and request an appointment, and it gets done.
Right.
Easier than ever.
And we're all in this together. So, tell your family and friends, if wearing a mask helps, we need to encourage each other to keep each other safe.
Larice, at what point in this whole process are you seeing most people come to you? Is there a certain age range of individuals who say, okay, I need some help with financial wellness? Does it take some time to mature into that role for one to come forward and say, look, Larice, I don't even know what I don't know. Can you help?
You know what? That's a great question. And I think during this time, because all people had was access to their phones and digitally everything was everywhere, I would say, as I taught different virtual courses, that the age range was very surprising, that I had young millennials to seniors on there. Even it was a variety of professionals on there. I had attorneys, doctors sometimes, with entrepreneurs and people right out of college. So they're really right now, I think that, again, a time like this where we've never been exposed to something like this, everybody is paying attention because everything is so uncertain. People don't know, are they going back to work? Are they going to get furloughed if they haven't already been? Will they have access to unemployment? So I think people want information. And that's one thing I'll push. A lot of you are watching this digitally right now. I would say share this and make sure that, that we get this information to our community and utilize your phones. We use it for everything else. You hear, Vanessa, you hear Dr. Modlin talk about all these websites and all these resources. And a lot of time we complain that we don't have access, but we have the most powerful tool in our hands every day. The average American looks at their phone, they said, over 700 times, because we look at text message, Facebook, Instagram, Snapchat, LinkedIn, email, text message, phone calls, voicemail. It goes on and on. So I would just challenge, if you are out there, again, answer your question. The age is varying, but now businesses on the flip side, right now, because people, they had so much uncertainty and they had to close their doors, immediately. Like I literally was sitting in my barber's chair on March 18th, and he told me today is my last day. I just got an announcement that they're shutting the barbershop down. So if you weren't prepared for that, your attention right away shifted to, how am I going to pay my house note? It went away from how am I going to pay my lease for my business to how am I going to take care of my family? So it really made a lot of people, and I don't care what level you were, if you were a business who've been around for 30 years and you had, a couple $1 million in the bank, or you had 100,000 in the bank, everybody wanted to know, because it's all relative, to how long you can last. So I would say, we did over 150 PPPs here through CLE, and it was a range of businesses. And it really, again, made people say that I need partners. You've heard Vanessa talk about that. I need an accountant. The average person may not have a Vanessa in their life where they can talk about, their cash flow. They can talk about, their balance sheet or their debt or their cash flow. So they have to, at this time, seek out partners that they can pay to do what they can't do or they don't understand. So again, I would just challenge everybody out there, look for those partners. I said that, very intentionally, because it's times like this where we say, well, we didn't have access to that. It was because we didn't have access in some cases to relationship. And then we didn't have access to making sure we had the right documents. And Vanessa, I know you know this because you mentor people. So a lot of it wasn't that we didn't have access. We didn't have our tax returns done. We didn't have financial statements. We didn't have all this stuff. And again, I'm not just talking about very small businesses. Some businesses that are doing $1 million, $2 million, didn't even know how to look at a cash flow statement. So again, this employee, I would just challenge everybody out there, look for resources, look on Google. We Google everything else in our community. We Google vacations. We don't have time to do that because we can't travel right now. We Google, the hottest pair of shoes. We Google, the nicest, clothing items that we want to wear. But right now, I would say refocus that time to look at things that are going to help you from a wealth perspective. And that just will be my challenge to everybody listening.
So true. Just echo that. The first thing I did with the 4-5 businesses that I'm investing in, the small businesses, they needed a good accountant, a bookkeeper. Right? I mean that's, and I'm a lawyer. I'd say get the bookkeeper or the accountant before you get the lawyer, because you don't know your financial situation. You don't even know if you're making a profit.
Yeah.
That's not a business. That's an arrangement.
I have a question here.
A very expensive hobby.
An arrangement.
There's a question here I'd love for you to answer. Someone asking about nutrition just generally and what they can do individually and as a family to help their immune system.
And that gets to the social determinants of health. A lot of us African Americans, we may not have the economic means to go to Whole Foods or get organic foods. Actually, many of us may live in environments that are food deserts. You take East Cleveland, for example. There's a lack of healthy grocery stores. People go to the corner.
We have green beans. We have green beans. Okay.
Oh, okay. Yes. So it's
corn. We have corn.
It's difficult. So the main thing is try to educate yourself in terms of what is healthy. It can be very confusing. At Cleveland Clinic, we refer a lot of people to nutritionists, dietitians. There's information out there on the internet. But the fact of the matter is we need to be aware of that. That is a contributing factor to our higher rates of hypertension and diabetes and other conditions. So, there are things that we can do to be mindful. We can, be less sedentary, exercise more, take more time for ourselves, reflect on what is important for ourselves and our families. But no, that's a very important point that we need to be mindful of our nutrition.
Great stuff. Yeah. And Dr. Modlin, I have a question here from DK. She asks, how can we bring a testing site to our church to better get our community tested? Now, that's a little complicated because right now, churches, those doors are locked. But that doesn't mean that there can't be a central location, I guess, what Dee is asking in terms of people going there. If maybe that's the nearest site, because some of these communities that we're talking about that are food deserts, many of those households don't have a vehicle that could get them to a location.
So most of the testing, COVID testing in Cleveland has been at the Walker Center, 105th and Carnegie. And that initially was a drive-through, and they added a walk-up testing option also. One of the things that the Minority Strike Force, the Governor's Strike Force, is working on is to try to identify additional locations, testing locations, right in the heart of the Black communities that would be more accessible. So I would actually, that's one of the subcommittee's tasks. I would actually invite people to email me, and I would love to speak with you and work with you to help identify additional testing locations. Then we would actually have to identify the workforce, the healthcare workforce that would go out and provide the testing. They'd have to have proper PPE, things of that matter. But I can give out my email, or we can post it up online. It's modlinc at ccf.org, modlinc at ccf.org. So no, I welcome any input because we're looking for feedback in terms of where we really should do the testing. Again, we know that African Americans have higher rates of disease, and we need to actually facilitate them getting tested. One thing people need to do is know the signs and symptoms of COVID. It's actually been estimated that up to 80% of individuals who may have COVID may not actually have symptoms, but some of the symptoms could be a fever. You may or may not have fever, shaking chills, a sudden loss of taste or smell. Rigors, tremors, shortness of breath, difficulty breathing. These are some of the classic symptoms. You need to know what the symptoms are, and then if you have symptoms, seek immediate medical care. The other point I wanted to make, it's not all about COVID. I mean, you can have other healthcare needs that we are here to treat. one thing that at Cleveland Clinic, we have the number one heart center in the world, but we've noticed that since COVID appears, we see less people coming into the ER with one of the most devastating types of heart STEMI. And it's not because less people are actually suffering these signs or symptoms of a heart attack or stroke. They're actually putting off getting these signs or symptoms evaluated. So if you have a serious condition that requires immediate medical attention, don't put it off just because we're in a COVID pandemic. That actually has to be evaluated.
Doc, and I had a board meeting right before this meeting, a Metro board meeting, and Akram Boutros, our CEO, shared that that is one of his major concerns. There's also something called death of despair, because you delayed going to the Cleveland Clinic for your heart attack. And when you come in, they found out that you did have, or you delayed going to Metro and you were having a stroke because you were scared of COVID. But cancer, heart attacks kill too. So I would encourage, and I believe the governor is going to lift all of the restrictions in the next week or so that you need to go to the doctor, you need to go to the hospital for these serious conditions. And as Doc said, sometimes you don't even know it's serious. So you still need to go get your mammogram, my sisters. You still need to go to the doctor. You still need to go to the hospital, even during COVID. COVID, yeah. But these other things can also kill.
Actually, there's a phone number for nutrition. Somebody, because we had a nutrition question. Sure. Diabetes, thyroid, weight management. 216-444-6568. That's at Cleveland Clinic, and I'm not here to advertise Cleveland Clinic. I know Metro and UH also have options, so I want to be fair.
Okay, let me get that.
Wait a minute.
I gave Cleveland Clinic a plug because they do have a wonderful website for businesses that are looking to reopen.
We talk a lot about health, and for great reason, but Larice, we just discussed 80%, Dr. Modlin, you said roughly 80% of the patients are asymptomatic.
It's estimated, yes.
As it pertains to finances, Larice, this really hits home when you were talking about get a bookkeeper, right? Because you can't really be asymptomatic with your finances. Either you have it or you don't. And you don't know you don't have it if you don't have that bookkeeper to tap you on the shoulder and say you need to get right financially. Can you expound on that a little bit more?
Yeah, kind of like Vanessa said earlier, when she said, she has been advising people that she mentor that their accountant sometimes may even be more important than their attorney. But I would say that they're both just as important. And people know I say, publicly all the time that we're like the toilet paper of the business. We should be at the beginning of the business, not once you're trying to make decisions or figure out what direction you're taking the business, but you need to gain that access to that individual. And they're great organizations right here in this community. If you feel like you can't afford a bookkeeper or afford, accountant write-off, you have the President's Council that's here. You have the Urban League of Greater Cleveland. You have Jumpstart. You have ECDI. A lot of organizations that are right here that have resources to help small businesses. So they can, attach you to an accountant or a bookkeeper to help you at least start off until you think that you can't afford. Then there's another organization, score.org as well. And they're, where they have retired attorneys and retired accountants or CPAs that will help you. They won't do the work for you, but they'll at least assist and give you an overview. But I would say, again, that is probably one of the biggest things that I hope that as Corona exposed a lot of business owners, that's what it did to a lot of people who wanted access to the financial tools that were out there. I hope that you learn that lesson, that the right people, pay people to solve problems and hire the right people to make sure that you have all the tools in your chest to be able to create a successful business. And like Vanessa said earlier, to allow you to scale. Because sometimes you only scale at the aptitude that you have in an area like finance, to your level. So hire people to really evaluate that and push you in that area and give you all the resources needed. So
hire people to get you right. Dr. Modlin, I have a question here from someone, Lamont Stewart. Hello, Dr. Modlin. I now teach ballroom dancing. what is the likelihood of getting back to teaching dance classes? We're talking about health. We're talking about not being sedentary. You know, you have to be in close proximity for some of these activities to work, right?
So, some of the dancing, I mean, Lamont would know better, but I think hopefully the governor will lift some of those restrictions. But again, I mean, going back to that activity in close proximity, I mean, you're going to have to practice some type of mitigation, wearing masks, washing hands. You're not going to want to do the close type of dancing that often is done in those facilities. So again, we have to be mindful about still the fact that COVID is still amongst us. It's not gone. So we just have to be very, very safe about opening up. And I hope, again, I hope that we do. I know Lamont, he's very passionate about what he does. And you know, dancing is a vital, you know, activity, you know, improve our health, our cardiovascular conditions. And so I actually hope that he is able to open up pretty soon, gyms and other facilities.
Dr. Modlin, let us find out you're out here cutting a rug.
Not me, not. I know Lamont is though.
Yes. We've got about 12 minutes left, and I'd like to give each of you the opportunity to share some final thoughts about this, because there are so many great questions. I can't get them all out there, and you all came so well prepared with slides and bullet points and such. Please, you know, I'd like to start with Vanessa. Any final thoughts that you'd like to share with folks out there? And we can divide these 12 minutes up evenly.
It sounds hokey, but we as a community are in this together. And I'll say it again, business owners, employees, customers, our institutions, our religious institutions, our schools. We all have to be mindful that what we do as an individual affects others. So I believe we're going to be in this, this, as the doctor just said, COVID isn't going to go away tomorrow. So we have to figure out together how to navigate this with our businesses and as individuals. So, wear the mask. Be mindful of, someone is talking about, be mindful of how you're feeling individually. Whether you prayer, take care of yourself, take care of others. This is a very stressful time. As a community, we don't always avail ourselves of the services that are available. I'm talking about mental health services. All of that is important during this time, because oftentimes you think you're doing okay, but down the road, it will hit you unless you start caring for yourself and let's care for each other. So that's my, someone asked about the spiritual. On a business, from a business standpoint, analyze where you are. Analyze where you are, and you're going to have to make some hard decisions. Look at what you have to do to reopen, and whether it makes sense for you to reopen. If you can only open at 50% capacity, you have to run those numbers and make sure that it makes sense. And if it doesn't, reimagine your business.
That's great advice.
Reimagine your business. Don't give up.
Don't give up.
And you may have to, work and take a job. I already told you, got jobs. That can lead to, and I'm serious, that can lead back to entrepreneurship.
Yes.
So we have to learn to pivot, and we do that as Black people. We know how to pivot. We know how to, we've come through worse.
We are resilient people, aren't we?
We are resilient people. Our people have come through worse, and we can make it through this, and we will.
Yes, Larice, you have any parting thoughts that you'd like to share with folks? Maybe concerns that are a little higher on the priority list than others, although they're all important.
I don't want to just talk from a financial perspective, because I have the opportunity right now. I'm looking out of my office window today, and I see the line stretched down the freeway for the food bank. And I want to make sure that people that are in position, that are listening, and we're talking about the disparities in our community and people that are unemployed right now, are those that are more likely that are hourly wage earners. So they weren't prepared for a pandemic. So there are a lot of people in our community right now that are in great need. And sometimes when we get to go home and we can choose what we want to eat, we don't realize as seniors that don't have families, they don't have transportation, they're on SSI. By the 10th of the month, they have no more resources. I would say reach out. Vanessa talked about we're all in this together. They say your brother's keeper. No, we're our neighbor's keeper in times like this. So I would tell you, and I would challenge us that if you're in position, check on your neighbor. If you have a senior, if you have someone with kids, your neighbor's out of work financially, then I would say something that I didn't get the opportunity to share is if you don't have life insurance or a health and care proxy or even a will in place, and Dr. Mullen can speak more to that, where you're going to the hospital and the whole family can't come. So who's making decisions on your behalf when you're in the room by yourself? As well as once you are diagnosed with COVID-19, a lot of insurance companies are not insuring people for life insurance. So we think that we saw a lot of GoFundMes in the past, but if we don't acquire life insurance in times like this, as the people get hit with this illness, as they're getting tested more in our communities, that's going to become a challenge as well. And the last thing I'm going to say, you see some of the resources on there. I would say, please, everybody, if you're listening to any of us today, share this video. I want this to be all over Facebook because you guys have heard stuff. There's so much information being flooded. People are overwhelmed. But when you're hearing accurate information, it's not just for you to get it, but it's for our community to share it and receive it. So utilize some of these. There are resources, but you have to use your Google for things other than, showing the top 10 Netflix movies of the week. But really look for things that are going to be impactful to you and your family's legacy, for your business, your finances. So there are resources out there. We've shared a lot today. You see them on the screen. And there's a lot of great organizations right here in our community. So I would say make changes. Recession equals reset. So use this time to sit back and look at your business, your personal finances, and take it to another level in times like this.
Yes, all of you are great resources. And Dr. Modlin, anything that you would like to share right now that maybe we didn't get a chance to touch on, or anything that you would like to reiterate?
I would just like to emphasize to the audience that everybody is a healthcare provider. You don't actually have to have a medical degree to be considered a healthcare provider. Every employee at Cleveland Clinic, we consider caregivers, healthcare providers, because you can actually gather and learn medical information and actually pass that information on to somebody that's going to potentially even save their lives. If you go tell them to get a mammogram or get a colonoscopy or get checked for diabetes, that is actually going to lower the communities' higher rates of health disparities, which actually is the contributing factor as to why we have higher death rates from COVID. We're here talking about this COVID pandemic, but we're really talking about something much more broad, which is actually higher incidence of health disparities, less access to healthcare, lower levels of health literacy. We need to promote cultural competency training on the part of our healthcare providers so that they can better engage the populations to come in and undergo the screenings. We actually, Ron Johnson, the president of the BPA, typed in a question, what can BPA do? Well, not only BPA, but all organizations can strengthen their partnerships with the community and with each other. These type of venues and events should be ongoing now, even after the height of the COVID pandemic is over. These are avenues in which we can exercise our abilities to educate the community, to reach out to the community. One thing that we've seen also, especially prominent in Black communities, is we're less likely to tell our families, our kids, about medical conditions that are more prevalent or hereditary in our own families. And we actually need to get past the stigma of that and educate our kids about diseases that are more likely to run in our own family. So there are a number of things that we can do. Hillary Clinton actually put it this way, and I wouldn't necessarily have put it this way, but she says, never let a good crisis go to waste. And so by me saying that, I mean, this COVID pandemic has actually unmasked the not only the health disparities, but the economic disparities, the social determinants of health that we've spoken about tonight. This is our opportunity to develop partnerships and influence and actually mandate and encourage our policymakers to formulate policies that are going to eliminate these social determinants of health, improve our housing, our economic situation, our nutrition, our food, our access to medical care. So we need to take advantage of the fact that we have a platform, we have the governor's attention, and we need to take advantage and develop new strategies to alleviate a lot of these healthcare disparities that we've spoken about today.
Great stuff, guys. I can't think. There we go. We got the full screen. We got the whole game here. I can't thank you all enough for your time. I've done stories over all of these subjects. Please believe I will circle back so we can, there's splinters in so many different directions. These conversations, we could take it in any direction. So I can only take it one conversation at a time with my newscasts and the stories that I get a chance to present. So that gives us evergreen topics, unfortunately, with some of these discussions, but it gives us plenty of content to educate our community, which is what we want to do. I thank you all so much for your time, and I want to give a shout out to bpacf.org. Again, bpacf.org, Black Professional Association Charitable Foundation. Check them out. They have a wealth of resources, including this esteemed panel of individuals. Thank you, and be safe, everyone out there.
Thank you.
Thank you. Thank you.
Thank you. Thank you. Thank you.